Hello everyone, welcome to another educational video. This video is dedicated to all caregivers of the special people in our lives. You are recognized and appreciated. Always remember to maintain a cheerful spirit because laughter is good medicine that can get you through a tough day. The slides have been curated to put a smile on your face. Hope you enjoy it. Today we will explore what dementia is and what you might expect your GP to cover. There are certain behaviors that make you want to assess a person for possible dementia. During the conversation, an 80-year-old person politely says "excuse me" multiple times. It's either he didn't hear you or he is struggling to retain information in the short term. Or you were asked by your staff to speak to a family because a pleasant 83-year-old woman kept ringing the practice asking what time her flu shot would be, not realizing she called 3 times last week to ask the same question. Another scenario is when your granddad forgets to button up his shirt or struggles to remember your name, and may often refuse to accept your word for it that the name you told him is actually yours. If you notice these types of difficulties in a person, mostly an elderly individual with a decline in brain function, over a considerable period of 6 to 12 months, it is time to ask your GP to further assessment and advice. The term dementia derives from the Latin root word which means being out of one's mind. In the current use of the word, it should encapsulate a variety of possible specific diagnoses, but in everyday usage, dementia is most often associated with the most common type called Alzheimer's dementia. You might ask, am I aging or do I have dementia? We usually see brain function decline in a spectrum where it's mild and mostly called senile forgetfulness that continues for many years. However, it can progress slightly faster, few years or less, to involve other crucial functions of the brain that lead to a loss of independence and inability to perform activities of daily living. How common is dementia? The increase in the number of people with dementia is driven by an aging population. Age is the strongest known risk factor for dementia. The chance of developing dementia rises significantly with age. There are 4 major types of dementia we can briefly explore today. These are Alzheimer's disease, which often coexist with vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. Alzheimer's dementia, AD, is the most common and most well-known cause of dementia. It is a progressive disease that slowly changes the chemistry and structure of the brain, leading to the death of brain cells. Becoming confused and forgetful and experiencing mood swings are common. Vascular dementia. This type of dementia occurs when the oxygen supply to the brain is cut off due to a stroke or a series of mini-strokes or TIA. It is a common form of dementia and can cause problems with speed of thinking, concentration, and ability to complete tasks. Lewy body dementia is characterized by the buildup of proteins into masses known as Lewy bodies. This protein is also associated with Parkinson's disease. With Lewy body dementia, attention and alertness problems are common, as are hallucinations. Though Parkinson's disease first affects the region of the brain that is key to movement, it eventually spreads and can begin to affect mental abilities. Parkinson's dementia affects memory, attention span, and judgment, and can look a lot like Alzheimer's dementia. Frontotemporal dementia is caused by damage to the front part of the brain. It can affect personality and lead to behavioral changes and eventually memory problems. A central feature of dementia is a progressive global deterioration in intellectual function and is a main cause of late-life disability. How do we diagnose? Dementia can be diagnosed when there is evidence of decline in at least 2 out of 5 cognitive domains, affecting activities of daily living, not explained by another disorder or adverse effect of medication. I've come up with a mnemonic that helps you remember the domains that characterize dementia, so that you'll be able to know areas of deficiency that can help you determine the possibility of worsening cognitive impairment. It's called jolt memory. These domains are judgment, which may present as taking worsening impulsive decisions, and reduced mental flexibility, orientation difficulties in time, place, or person, not realizing where they are repeatedly. Language problems such as mild trouble finding relevant words and forgetting names is usually present. With progression, there is more difficulty in naming objects and using substitute phrases for common things, then followed by comprehension problems. Dementia affects a person's thinking abilities. They may find planning and organizing difficult. A person with dementia will usually need help from friends or relatives, including help with making decisions. They find it hard to carry out familiar daily tasks, such as getting confused over the correct change when shopping. Memory loss leads to forgetting the names of people, life events and objects, getting lost in familiar surroundings or on familiar journeys, forgetting how to carry out familiar tasks. It is expected that the diagnosis will largely be recorded following patients being referred to secondary care with suspected dementia, or as an additional diagnosis when a patient is seen in secondary care. However, your GP can also make a diagnosis based on their clinical judgment and knowledge of the patient. The GP can screen for the possibility of cognitive impairment by taking a full history and physical exam. This will also include a cognitive screen using a number of tools. 6CIT with clock drawing test can provide a quick screen for difficulties in the 5 cognitive domains. The use of these screen tools is limited by background literacy or intelligence level, and physical impairments of hearing or sight. It is common to find elderly patients with cataracts and age-related hearing loss. History from relatives reporting a rapid decline in intellectual function is crucial in determining the likelihood of dementia. The GP fulfills the quality outcome framework indicators by keeping a register of patients diagnosed with dementia and offering an annual review. The content of this review is tailored to patients' needs. However, we often use a framework to capture key features that can improve quality of life and reduce the burden of illness on the individual and their carers. What are the common myths about dementia? Only elderly people can get dementia. Many people are led to believe that only older people are affected by dementia. However, this is not the case. While it is much less common, young-onset dementia affects those of working age, usually between 30 and 65 years old. It is common in a person born with Down syndrome who may develop dementia at an early age. Beer wards of dementia. A severe thiamine deficiency can result in an inadequate supply of energy to the brain, causing the brain and nervous system to become increasingly damaged over time. This damage can cause increased difficulty with memory, movement, vision, and coordination. In the UK, the recommended limit for alcohol intake per week is 14 units for both men and women. How to manage dementia. The cost of dementia care is huge in the UK, over £26 billion annually. In this cost of living crisis, families may not be ready for the toll this might take. About 2/3 of the cost of dementia is paid by people with dementia and their families, either in unpaid care or in paying for private social care. It is often said we are once an adult and twice a child. A lot of caring responsibility lies on the person and their family. It takes several adjustments to co-design a support that fits your family's needs. Signpost patients and their families to resources locally to assist them in their journey. I have put some links in the description below. Clinicians are there to support you, but are also alerted to notice safeguarding issues. People with dementia will have cognitive symptoms that may make them more at risk of abuse or neglect. If there are concerns about abuse or neglect of either the carer or the person with dementia, a carer assessment should be requested to organize a structured support plan. What drug treatments are available to manage dementia? There are currently no interventions that alter or cure the long-term progression of dementia. Acetylcholinesterase inhibitors are the first drug class to improve cognition in some patients with Alzheimer's dementia. The 3 currently available are donepezil, galantamine, used in Alzheimer's, and rivastigmine, used in Alzheimer's dementia, and Lewy body dementia. Clementine is licensed for severe Alzheimer's dementia. A systemic review of trials showed that you need to give 12 people these medications over a 12-week period for one person to benefit. In the research, the benefit was defined as an average gain of 3 points on a 70-point scale for cognitive function. Side effects were equally common and included mild gastrointestinal symptoms, urinary incontinence to more significant ones like tremors, agitation, low pulse rate, dizziness, and hallucinations. Discuss with specialists to decide who may be suitable to trial these medications. How do you manage the dementia patient refusing treatment and lacking capacity? There are 5 sections of the Mental Health Act that may affect GPs in an emergency situation. I have put a link in the description below for more details. The Mental Capacity Act is a law in England and Wales that safeguards and empowers people who lack decision-making capacity, while also providing guidelines for decision-making. It covers everyday decision-making, such as decisions about what a person wears, what they eat, and their personal care. It also covers important decision-making about a person's property, financial affairs, and health and social care. In this video, we have covered the management of dementia in primary care. Thanks for watching.